going to talk a little bit about HIV case management services and also about services to people who are aging in general in the Philadelphia area. So, you know, whether or not you're HIV positive, those services will relate. Also, as a caveat, kind of the HIV world and the funding that we get, an older adult is defined as 50 years of age or older. In the aging world, for instance, Philadelphia Corporation for the Aging, the services, with a few exceptions, are for people 60 and over. So just sort to get that. So the first slide is, I just put up the mission statements from ActionAIDS and from the Philadelphia Corporation for the Aging. They're probably pretty typical of mission statements for organizations like this. But what I wanted to put out, that both of them have enhanced quality of life and improve the quality of life. So, you know, the missions can be pretty similar, all right? We want people to live healthy. We want people to have the resources they need to live healthy, productive lives, and we are here to help you do that, to see that you are getting the resources, that you're not sort of hanging out there alone and you know, making a lot of phone calls or just not knowing where to go for help. So some of this information, you know, and please, when you leave here, share it with others, with people you know. There are copies of the slides on the table, so you don't have to be writing phone numbers down, some of the things that you'll see posted here. Okay, the next one. What is medical case management? All right. Our medical case managers are, for the most part, social workers. At ActionAIDS, we actually do have a nurse case manager in addition to that, and you know, other people who are trained in working with human services. The case management, in order for it to really work, it really depends. You know, we place the relationship between the case manager and client as primary. You know, for things to work, that relationship has to work. For, you know, clients should feel free to talk to their case manager about whatever issues, whatever barriers they're having to getting their HIV care and other resources. And let me just address that a little bit. If you came into ActionAIDS and were assigned a case manager, you would more than likely, it wouldn't be somebody that looks like me. It's going to be somebody a lot younger. All right. Believe me, these people have been well trained in, you know, your issues with your HIV, in aging, you know, so please they've had different experiences than you have, but they have a lot of empathy. They're really a lot of great folks there, okay? So it is the establishment of that relationship, working together to coordinate care, to, you know, the systems can be very complex. You know, we're looking at somebody holistically, not just, you know, are you getting your HIV care? Are you getting your medicine? Is there any barrier to that? Is there a transportation issue? Is there a housing issue? You know, are you not getting the nutrition that you need? These are all things a case manager can help you out with. These are just some, you know, of the many things we can do. Also, within the aging system, there's also a wide range of services available that, you know, your HIV case manager may not have direct access to, can certainly access that system. And you can be a client of both systems. You can have a case manager at a place like ActionAIDS. You can also be working with somebody from one of, you know, the Philadelphia Corporation for the Aging or one of their subcontractors that can help you with that. Okay. So what is HIV case management? So basically from the beginning, it's linking you to medical care. Sometimes that can be, you know, finding a provider. And if you don't have a provider, what the case manager will do is talk to you, sort of see like where you live, you know, what some of your issues are. They're pretty good at matching people up, you know, with a provider. You know, some people, you know, want whoever is closest to where they live. Others don't. You know, there might be disclosure issues. They may not want neighbors seeing them walking into a certain facility. So we can, you know, we can help folks with that too. Also with pharmacy issues, we can help a lot with that. I know the insurance can be tough. We can get people medication, a medical case manager, regardless of their insurance coverage or if they don't have insurance coverage. There is a program through the state of Pennsylvania which helps people without insurance. Also folks with deductibles, private insurance, if you have a deductible and financially you are eligible, we can help you get into the Special Pharmaceutical Benefits Program, which will pick up those costs of your HIV medication and possibly other medication that you're on, where there might be some co-pays. We can also link people to mental health services and to substance abuse services. We don't require people to be clean and sober and in mental health care to access our services. You know, basically we function on a harm reduction model. When someone is ready to get into that, we will help you. But, you know, please, you know, if someone is still actively using drugs or alcohol or maybe has dropped out of the mental health system, we can help that. You know, of course, we ask people not to come into the office highly under the influence, but no one would be, you know, turned away for any of those reasons for HIV care. Also, public benefits. You know, one thing I noticed, this pen has a prize on it. Just saw that, the pens are giving out here. Very good. This is, I think these folks are trained. I think they are connected with Philadelphia Corporation for the Aging. You know, how many people here had a good time with the Part D, figuring that out on Medicare? All right, yeah, it's a party, I know. These people can help you. These are trained volunteers. So I just wanted to give a shout out to the PENs in that program. Okay. Housing issues. That's really big. Safe, affordable housing. It's a process. It's not quick, but you know, we can help you with that, and also Philadelphia Corporation can help you with that. There's many buildings in the city that are subsidized specifically for senior citizens and or adults with disabilities. So, you know, that's something we can refer you to. Basic human needs. We have a lot of linkages with the various food banks, some which are specific to people that are HIV positive, but, you know, some that aren't. Case management can help you access that, can make a referral to that, and other programs. It's really, you know, we want people to be healthy and to have access to the nutritional things they need. Also, legal issues. You know, some of you may be familiar with the AIDS Law Project and community legal services. We can make referrals there. Specifically, a lot of the work that they're doing these days is assisting people with disability claims. It seems like pretty much Social Security denies everybody the first time around. Don't know why, I mean, but they do. You know, we encourage people to appeal that and to get legal representation when they go in to that appeal for SSI, SSDI benefits. And, you know, other legal issues too, maybe some landlord-tenant things. Also, you know, it's probably still out there. Any kind of discrimination that you've encountered because of your HIV status, your sexual orientation, your age, you know, that might be something you need to take into legal services too. And, you know, the case manager can, you know, refer you to a service that is either free or low cost that can help you with some of that. So the next slide is just how do you access services for HIV case management. ACO Client Services is basically a centralized intake unit for the city of Philadelphia, actually the 5 counties in the area. So if someone is looking for HIV case management, that's kind of the number to start with. They have very, very highly trained intake workers there. Expect to be on the phone maybe for about 45 minutes, so set that aside. And then you can choose the AIDS service organization you wish to get your case management with, or you can just say, you know, first available, you know, opening for help. So that's, you have a choice in your case management. Also, you can go or call an AIDS service organization directly, especially if you're having some kind of an emergency. You know, if you walk in, they may be able to help you in that particular time and then link you with the ACO Client Services. I have ActionAIDS offices here and our phone number and website, so you can call or walk in during the hours stated there into any of our offices. As you see, we're now down in Delaware County also. We've partnered with the Aged Care Group, so we have a presence in Chester and also in Sharon Hill, Pennsylvania. So can do that. Okay, I've also listed, giving you three other actually, AIDS service organizations who